today for our monthly Strengthening Families webinar, which today is focused on the topic of community development and early childhood partnering for better outcomes. I'm very pleased to be joined by colleagues from NeighborWorks and from around the country. So we're going to share a little bit of orientation and welcome, and then we'll jump in and start hearing from folks. Just a little bit about this series of webinars. Each month we hold a webinar that is open to anyone who's interested. Ideally, people who are familiar with Strengthening Families Protective Factors Framework are interested in learning more about it. We convene these jointly with my organization, the Center for the Study of Social Policy, and the Children's Trust Fund Alliance. And each month we coordinate a topic with usually guest speakers or facilitated conversation. So if you have suggestions for topics for the future, please feel free to contact me, and we would be happy to work on working that into the schedule. We also always post the recordings and slides and any handouts at a Google site that's maintained by the Children's Trust Fund Alliance. So you can always go there if you miss one, or if you're wondering if we ever covered a particular topic, you can go and scroll through probably about 10 years worth of these monthly webinars on there. It's quite an archive. So as I said, we do this the second Thursday of each month at this time. We're playing around a little bit with sometimes doing longer, sometimes doing more interactive, sometimes doing straight webinar style like we're doing today. Although we still invite your questions, we're not doing like small group breakouts, but we're kind of playing around with options on that. In February, we actually will have a smaller group, not open invitation, but just our state Strengthening Families leads. So if you are on the list as a Strengthening Families lead, you should have gotten an email from me earlier today. And if you are not on that list, but you think you should be, please reach out to me, whether that's because your state is involved, but you aren't listed as a state lead, or because your state hasn't been part of our network yet, but you think you're ready to join. We'd be happy to welcome you to that call on February 11th. And then March 11th, April 8th, May 13th, just mark your calendar for those second Thursdays, and then you can keep an eye out for the topics and register if it's a topic you're interested in, or free up an hour on your calendar if it's not. As I said, we're currently considering changes to our schedule and sort of how we offer these webinars. So if you could take a few minutes to respond to a survey, I'd be very appreciative. I'm keeping it open through tomorrow, and my colleague Selena is putting the link in the chat box, so you can just click through to that Google survey and let us know what you get out of these webinars, what you want to get out of these webinars, and give us some ideas for shaping the schedule going forward. All right, today I'm very excited about our topic, and we're going to hear from, as you can see on screen, a lot of people today. We're going to have a lot of different voices sharing their perspectives. First, we'll hear from two of my colleagues at NeighborWorks, Angela Ross and Tisha Allen, who have helped to lead this action lab. Then we'll hear from four different community partners who implemented projects as part of this action lab. First, we'll hear from Anna Gwynn Simpson and Annie Hankins at EdenHousing. Then we'll hear from Anita Kumar and Adrian Smith-White at the East Bay Asian Local Development Corporation. We always just say EVOLVC, so I had to really think that through. Laniqua Howard is with us from First 5 Alameda County, and then Jamie Lee Bradshaw will share from Community Partners of South Florida. And then my colleague Selena Chavez from CSSP will be sharing some of our lessons learned, and we'll have plenty of time then for Q&A. We'll wrap up with some updates from CSSP and from the Children's Trust Fund Alliance, and we'll send you on your way. One note, we've been getting requests, I've been getting requests for certificates after participating in these webinars. And so if that's something that you need, we used to have that auto-generated when we were using GoToWebinar, and now that we're on Zoom, it's not doing that. So I know some people were left in the lurch without a certificate. So there's a Google link in the chat box, and you can click on that and request a certificate, trying out a new system to try to streamline that for those who need it. Okay, so for today, before we formally jump into the presentations, we wanted to find out who's with us today. So I'm going to put a poll up on the screen. Please let us know which field you primarily identify with, whether it's early childhood, family support and child abuse prevention, housing and community development, or something else. And then whether you're currently involved in partnerships that cross those fields that we're going to be talking about today. Give you a minute to fill that out. I think also on your screen, or possibly when I close the poll, you can see a link to the full report about this work. You won't be able to hear from all the communities today, so I encourage you to read that report and learn about other projects that were carried out as part of this action lab, and that's an easy way to share this information with other partners in your community. that you might like to share it with. So looks like about 80% of you have voted. So I'm going to end the polling and share the results. The majority of our participants today are coming from the early childhood field. That's not too surprising given our mailing list with Strengthening Families, and a good number who are in family support or child abuse prevention. And then just 15 or 11% who are coming from the housing and community development side. So this might be kind of clear which side of these partnerships we're mostly talking to. And we'll be doing more outreach on the housing and community development side going forward as well. The good news is that the majority of you say you are involved in partnerships that cross that divide right now. So that's exciting, 55%, but 45% who aren't involved in those partnerships. So I hope you'll get some ideas today for how and why you could do that. All right, with that, I will hand off to Angela and Tisha, who are going to talk about the work that we did for this project.
All right. Thank you so much, Kaylin, and thank you all for joining us. I'm so pleased to join you today to share a little bit about this exciting partnership between NeighborWorks America and the Center for the Study of Social Policy. I'm going to give you some details on why we felt this partnership was necessary and what we did to create this program. It is pretty well established, I think, amongst scientific literature and our practical experience that children can blossom when they have access to affordable, healthy homes, vibrant neighborhoods with safe places to play, opportunities to learn in good schools with community resources, accessible public transportation, healthy foods, good employment opportunities for their adult caregivers. So many factors. Conversely, early childhood development can be hampered when children don't have access to those things, and structural inequities based upon persistent racial and ethnic segregationist policies mean that Black, Indigenous, and other children of color are often likely to have less access in their communities to those positive factors which support early childhood development than their white counterparts. Where a child lives and learns undoubtedly has a tremendous impact on their health, learning, development, their future, and the future of their children. Across sectors, organizations now recognize that support for families with young children is key to ensuring that children are best prepared for a bright future. Early childhood advocates increasingly recognize the importance of these community determinants of health and are paying closer attention to the housing, neighborhood, and community conditions in which families raise young children. At the same time, housing and community development professionals are also recognizing the need to support families and their young children to nurture positive development and to help address systemic challenges across generations. So there was a natural synergy for the Center for the Study of Social Policy with their partners' focus on early childhood development and NeighborWorks America with our network members' focus on affordable housing to work together to make a greater difference in children and their families' lives. So we got to work. In 2019, NeighborWorks and the Center for the Study of Social Policy convened an action lab in New Orleans, where we hosted 5 affordable housing-focused NeighborWorks network members and 4 early childhood development-focused counterparts in communities that are part of CSSP's Early Childhood Learning and Innovation Network for Communities, or EC-Link. I'm surprised I got that out in all one breath. I'm proud of myself there. The goal was with this partnership to create and carry out projects designed to benefit families with young children that meet at the intersection of community development and child development. And on your screen here, you should be able to see the list of organizations that were engaged and where they were located. Urban Edge and the United Way of Massachusetts Bay and Merrimack County in Boston, Massachusetts. This project offered a 2-generational approach to school readiness. Community Partners of South Florida and Children's Services Council of Palm Beach in Palm Beach, Florida. And this project focused on home repairs and code enforcement remediation for families and access to family support services. East Bay Asian Local Development Corporation, or EBALDC, and First 5 Alameda County in Alameda, California. This project focused on strengthening an early childhood education and resource hub at the Family Resource Center. EdenHousing and First 5 Alameda County in Alameda, California. Again, this program focused on access to quality parent support programs and parent engagement in affordable housing. And Mutual Housing Association of Greater Hartford and Connecticut Children's Medical Center in Hartford, Connecticut. This project was designed to improve housing conditions with a goal to improve overall child health. We'll have a chance in just a few moments to hear from several of our partnerships about what they did. The teams, before we get to that, the teams did agree on 3 grounding frameworks to inform and guide the work of the partners and the partnership itself. Those 3 grounding frameworks: number 1, the socio-ecological model of human development puts an individual's development in the context of the relationships and environments in which they develop. Second, social determinants of health are conditions in the environments in which people live, learn, work, and play that affect a wide range of health, functioning, and quality of life outcomes and risks. And third, strengthening families is a research-informed approach to increasing family strengths, enhancing a child development, and reducing the likelihood of child abuse and neglect. At the Action Lab in New Orleans, participants shared how they would be using these grounding frameworks and developed this graphic that you see, depicting a hybrid of the overall housing, health, and early childhood systems and frameworks that families engage with or experience. Each of the participating NeighborWorks organizations received a grant of $10,000 to support their community's efforts. Teams returned home from the Action Lab to carry out their projects, participating in monthly Action Lab meetings to learn more about each other's projects, to engage in joint problem solving, and to share resources. Although each project was different, it was responsive to the needs of the communities and how the partners complemented each other. The projects can be grouped into several different types. Several projects used housing as a platform for child and family services, such as providing resources for early childhood education, expanding the services of that family resource center or parenting program, and educational initiatives directly providing books and resources to families. 2 of the projects improved housing stock for families with young children, recognizing the effect of home and community environments on child development. Several of the communities conducted collaborative learning sessions where affordable housing and early childhood professionals shared experience in their fields as part of their larger projects. Each NeighborWorks and EC-Link Action Lab team collaborated on the purpose, design, and implementation of their projects and had to navigate working in unique partnerships with each other to benefit their shared community. For some teams, this meant expanding the services of one organization to the population of another. For others, this meant one organization providing staff training, technical assistance, expertise, and support, while the other took the lead in implementing the project. So by now, you've kind of gotten a little bit of the background of the how and the why, but I'm sure you're more than eager to hear from some of our teams. So I'm going to turn it back over so that we can learn from their experiences in this project.
Thank you, Angela. And I'm very pleased to welcome Anna Gwen Simpson and Annie Hankins from EdenHousing in Alameda County.
Good afternoon, everybody. We're so excited to be here today. As Kaylin mentioned, my name's Anna Gwen Simpson, and I'm the Vice President of Resident Services at EdenHousing. And with me today, I have Annie Hankins, who's our Youth Programs Manager. And we're going to just describe a little bit about our partnership with First 5 Alameda County. So the mission of EdenHousing is to build and maintain high quality, well-managed, service-enhanced, affordable housing communities that meet the needs of lower income families, seniors, and persons with disabilities. Eden was founded in 1968 by a group of passionate volunteers, and for over 50 years, we've been providing safe, affordable housing to communities throughout California. We really believe that housing is a platform for families to succeed, and our homes are the launching pad for children to go to college and families to get ahead, and a landing place for our seniors to age in place with dignity, courtesy, and respect. We work in partnership with cities and local community partners to build housing throughout California. We currently have over 145 properties in our portfolio serving and housing 22,000 low-income residents throughout the state. And that's a little bit about who we are as an organization. Resident services is a key part of the work that we do, and I'm going to let Annie talk about our partnership.
Hi everyone, I'm Annie Hankins, Eden's Youth Programs Manager. So for our project, Eden and First 5 Alameda County worked together to build upon one of the programs we were already doing at Eden, and that program is Raising a Reader. Raising a Reader is a research-based family engagement and early literacy program. This program focuses on the importance of sharing books with children ages 0 to 8. The goal of Raising a Reader is to help families practice and maintain at-home-based literacy routines. So sharing books increases family bonding time, which fosters the nurturing environment and experiences children need for healthy brain development. As families spend time engaging with their children, they can have a huge impact on their child's brain development. And Raising a Reader does this through a 10-week book bag rotation model where youth take a book bag home every week. They return it back to us at the leasing office, and they're given a new bag in return. So for this project, we decided to build upon something we were already doing, Raising a Reader. So I'll talk about our collaboration and how we built upon our project. So we decided we wanted to make our Raising a Reader program even better. How could we add more resources to help families engage more together at home? So Alameda First 5 helped us do this. They provided us with guidance on what additional developmental resources we could add to our bags that would increase family engagement. With their guidance, we purchased supplies from Lakeshore Learning, and each bag contained 3 books, an educational game or activity, and a puppet. So the bags were full of high quality, really fun early childhood resources. Additionally, First 5 also helped us in creating a really high quality pre and post survey to help us measure our program's outcomes. Lastly, First 5 helped us with training. We went to their center in Alameda and our staff received some incredible training on early childhood education. So that was a bit of how we partnered together, and I'll talk a little bit about our program model. So we did the program in a way that was very manageable. We ran it at 3 of our properties in Alameda County, and we had 25 youth engaged in the program. Additionally, we wanted to increase family engagement, so we decided to hold 3 family engagement events in the program. We did one at the beginning, middle, and end of the program. And at the events, we provided early childhood resources from First 5 to share with parents to help them, have some resources to enjoy. But we also had some really fun activities at our family engagement events. We had story times, we had game times, and we even had a time where parents and the children would write a story together. So it was a really successful time, and it really helped families connect and grow. The main focus of the program, however, was the 10-week book bag rotation, and families would come every week to the leasing office and exchange their book bag for another one. We found this was a really great way to have families engage more often with the property staff and to see families regularly. And because families love the bag so much, they came to the office every single week. Additionally, to measure the outcomes of the programs, caregivers were given a pre and post survey where we measured how parents were engaging with their children before and after the program. So that was our program model. And I just want to discuss a little bit about our collaboration with First 5 during COVID. So our program actually ended in February 2020. And then because of COVID, we had to put the Raising a Reader program on hold because it was challenging to share book bags at the time. However, in September 2020, First 5 Alameda County donated early childhood resources to Eden. And if you see there on the picture, that is the team there with some of the boxes they donated to us. And the donations included books, Play-Doh, flashcards, coloring books, colors, markers, and writing tablets. We used the donations to create early childhood enrichment bags, and we created a flyer with tips for parents on how to read at home together with their children. So if you see the next slide, we have a sample of the bags we created. We are very thankful for the partnership we developed with First 5 Alameda County. Though we had to put our normal program on hold, we were still able to continue to support our youth residents with high quality early childhood resources. Thank you.
Thank you very much, Annie and Anna Gwen. And I see a couple people were asking a question about whether they could see the pre-post survey. So maybe that's something we can get to in the Q&A, but just wanted to raise that so you see the question that had come up. Next, we're going to hear from the other NeighborWorks partner in Alameda County who participated in this. And then after that, we'll hear from First 5 Alameda, who worked with both of these NeighborWorks partners. So now we're going to hear from the Healthy Havens Court Collaborative, part of EdenHousing, and we're hearing from Anita Kumar and Adrian Smith-White, and I'm so glad you can both be with us.
Thank you, Kaylin. Hi, everyone. I'm Anita Kumar, and I am Senior Manager at Neighborhood Collaborations at EdenHousing. I'm going to stick to the acronym because the whole thing is kind of a mouthful. You've heard it a couple of times. And I'm joined with my colleague here, Adrian Smith-White. And for just a quick description of EdenHousing, we are a 45-year-old community development corporation that's based in Oakland. We develop and preserve affordable housing. We also manage a robust resident service program across our properties, as well as a portfolio of commercial real estate, which we lease to local businesses and nonprofits at below market rate. So that's a little bit about EdenHousing. So Healthy Havens Court, okay, yeah, you're on the slide. Thanks, Kaylin. Healthy Havens Court Collaborative was launched in 2015, and it's a place-based collaborative that's focused on the Havens Court neighborhood of East Oakland. Healthy Havens Court brings together residents, community-based organizations, and public systems, such as First 5 Alameda County and Oakland Unified School District, with the purpose of aligning resources and strategies to deepen impact around resident health and well-being. And in this context of the collaborative, EdenHousing serves as a backbone convener for the group. And the impetus for forming the collaborative was that, and is place matters, as Angela mentioned, as a community development organization with deep neighborhood roots and a deep neighborhood focus throughout, and a strong track record in working with partners to strengthen the social determinants of health. EdenHousing felt there was a need to bring partners together with the explicit focus on aligning vision, goals, resources, and strategies, along with a shared measurement system, so that we could really move the needle on supporting the positive health outcomes across a person's life trajectory. So with that said, and if you could move to the next slide, Kaylin. With that said, one of the key priorities of the collaborative is strengthening early childhood development supports for Havens Court's birth to 5 families. Havens Court is a predominantly young community. There's around 20,000 residents who live in the neighborhood, of which 57% of the residents are under 35 years old, and 10% are 0 to 5. So it's a very large, there's a huge birth to 5 community in the neighborhood. And data also showed that up to 1/3 of the kindergartners entering one of the neighborhood elementary schools had no preschool experience, which we all know is a key predictor of kindergarten readiness. So the collaborative's education partners agreed to make a real impact in turning the curve on Havens Court children's education outcomes. There was a need to focus resources and strategies more upstream before the kids enter the K-12 system. So they also wanted to leverage a key asset in the community, which is a family resource center located at EdenHousing's Lion Creek Crossings property. And in 2019, the collaborative was awarded a multi-year grant to build out an early childhood education and resource hub at the Family Resource Center. This is called the Havens Court Cub House. What you're seeing on the slide is the flyer, one of the flyers for the Cub House. Bananas, a core partner of Healthy Havens Court and a well-recognized Bay Area early care resource and referral agency, is the lead partner on the initiative. And the vision behind the Cub House is to essentially serve as a birth to 5 one-stop resource hub. Some of the current services include childcare and family service navigation, FFN playgroups, 0 to 5 resource supports, such as supports in housing and SNAP and WIC enrollment. The Cub House also offers kinder transition activities, such as a parent university and a summer pre-K program, along with parent leadership opportunities. So you can imagine when we discovered the Action Lab opportunity, the timing couldn't have been more perfect. The Cub House had just launched, and EBALTC and First Five immediately thought this would be a great opportunity to deepen the partnership and expand, or at least pilot additional early childhood services at the Cub House. And so I'm going to turn it over to Adrienne to talk about the project.
Hello, everyone. I'm Adrienne. I'm the Resident Services Manager at Lion Creek Crossings. And it was definitely an awesome opportunity to be able to start the Learning Adventure Backpack Program in partnership with Alameda County First Five. And we were able to build by starting with 18 backpacks that consisted 4 to 5 books that explore different themes like literacy, science, math, social skills. And we are also able to have books in both English and Spanish because we do have a large Spanish-speaking population as well. We are able to check out at 2-week intervals. And our objective was to support early childhood literacy as well as strengthen the bonding time with children and their parents and have engagement with their children. We're able to really successfully launch this program by working with one of our partners through Bananas, who offers play groups at our facility or offered them pre-COVID at our facility. So we were able to get a captive audience, so to speak. We had a group of folks that were already there working with our kids and having fun, and what a better way to be able to offer resources than to be able to join the play groups and offer the backpacks as well as talk about some of the resources that we could connect them to as staff at our Family Resource Center. So it really became a really nice program to pull together. One of the things that we did learn is that we do want to be as all-inclusive as possible. So some of our Arabic-speaking parents were asking for books that were relevant to their culture. So that kind of brought us back to really look at, what books could we offer in the future. And so we ordered more books to kind of expand our selection that we're able to offer to our families. And it's given us a really wonderful opportunity to just really get to know the families. One of our families, really cute story, she would check out the backpack. She's a mother of 5 with 3 under 5. And she would actually throw the backpacks in the bottom of her stroller. And when she had her babies on the bus on her way to different appointments, she would just pull that backpack out and read books with her kids and allow them to like fumble around with the books. And so that became kind of a regular thing for her. And she really expressed that she was really happy that we were able to offer those resources. So we definitely learned a lot and definitely super grateful for our partnership with Alameda County First Five. Laniqua also offered us some kits, some Play-Doh and books and all that wonderful stuff so that we were able to hand out to families during the pandemic as opposed to trying to check out backpacks. And so thank you so much. And that's our program.
Thank you, Adrienne and Anita. And now we're going to hear from Laniqua, who's the Senior Administrator for Programs at First Five Alameda County and was involved in both of these partnerships. And they do a lot of other neighborhood-based work there as well. So Laniqua, take it away.
Yes, good afternoon, everyone. It's such a pleasure to be here with you today. As Caitlin said, my name is Laniqua Howard, and I'm the Senior Administrator for Programs at First Five Alameda County. Alameda County is an innovative public entity that seeks to help young children grow up healthy and ready to learn. And to meet this mission, we really rely on our partnerships with families and communities to build countywide continuous early childhood system of care that focuses on prevention and intervention strategies. And because we know that families children grow up not only in the context of their families, but also in the context of their communities. We spend a lot of time thinking about how to leverage place-based strategies. And so for us, this partnership with the Action Lab was a no-brainer. And because of this partnership, we have been able to really work with both EdenHousing and EdenHousing to meet families where they are, in their homes, in their communities, in their leasing offices, to really bring the services. And I think one of the reasons why both pilots were really successful is because of the accessibility of the services right there in their community, and because of the ability to engage with families that they had already started to build relationships with, and because the services were administered to residents by trusted staff. And so we really lifted that up as a lesson learned for us, because it shows that we were able to really support families that we might not have had a chance to otherwise, just given how large the county is and the services that people tend to gravitate towards. And so we have just been tremendously thankful for these partnerships. And what I have appreciated both about EdenHousing and EdenHousing is that because we've been able to strengthen our partnerships, they've been really honest about what would be beneficial for their staff and for their families. So we were able to customize both our curriculum around early child development training for their staff, as well as the type of resources we provided to the families in the community. And for us, it's really important to uplift the strengths of those communities and also enhance early child development resources there. So really partnering with families and community to figure out what's important for them and what the needs are, and then meeting that need. And because of our work together, I feel that we have been able to do that. And while the pandemic threw everyone off, and it really meant that we had to limit the backpack rotation because of health and safety, EdenHousing and EdenHousing are now part of the fabric of First Five. So when we thought about agencies that could benefit from educational materials to really keep families engaged and their children learning during the pandemic, they were at the top of that list, so that we could really leverage the work that we built together and started in this Action Lab and keep that going despite the pivots that we've had to make.
That is great. Thank you, Laniqua. Great to hear all about different angles on that Alameda story. So thank you all. Next, we're going to hear from a different type of program, a project that was carried out more focused on the housing side of how to better serve families with young children. And so Jamie Lee Bradshaw is with us. She's the Chief Strategic Initiatives Officer at Community Partners of South Florida and a longtime partner with the Children's Services Council there. And she's going to share some about what they did there.
Thank you, Kaylin. I'm so glad you said my title and I didn't have to say that long title myself. So I really appreciate the help. So as Kaylin said, I work for Community Partners of South Florida. We are a comprehensive community development agency located in Palm Beach County, Florida, where it's a very cold 68, which is why I'm wearing a sweater. It's very cold to us. And as Kaylin said, we have been a partner of the Children's Services Council, EC Link kind of network for a super long time, using a place-based model called the Bridges. So the Bridges are 10 community hubs located across Palm Beach County, which aims to increase the parental and community capacity. So everything a parent needs to feel secure and engaging and getting their child to their desired level, as well as, once that's covered, what it means to take on more civic roles in their community. We truly believe that residents can run their own community. We need to be there to help them mitigate the barriers that the system has placed in front of them. I won't get too deep, I promised Kaylin. So a little bit about the partnership. Not only did we partner with one of the locations called Bridges at Northwood, which is located in our central West Palm Beach area, but we also partnered with our local partner called North End Rise, which aims to identify community residents in a geographic location. And actually North End Rise is a program which is a purpose-built community. So some of you across the country have heard of purpose-built communities, and that is the one that we have in Palm Beach County, North End Rise. So we kind of partnered a bunch of people together. So it was us, it was Bridges at Northwood, it was North End Rise, and we are different. Even though we are focused on housing, we are a little different than my counterparts and peers that we didn't own a piece of property. We didn't have an apartment complex, we had nothing, we just had partnerships. We had really great relationships with these entities and these communities and these residents. And so we use that. We engaged our residents to better understand the challenges that they were facing. Through our relationship with RISE, we coordinated with Northmore Elementary, which was the feeder elementary school for all of our 0 to 5 families. So as the Bridges and North End RISE engaged them while they were 0 to 5, we also started talking to that elementary school. What are the things that are challenging our children from coming to school healthy? And what we heard from them is that there's asthma and there's issues related to their housing situation, which, you know, obviously early childhood, but also housing, that intersection made our antenna go off and said, here's an opportunity to create tangible change in these individuals' homes that we can experience better health outcomes for children, which means they can attend school or early child care. So what we did is we had informational sessions before COVID hit with our families, and we identified some funding that, along with our pilot funding, to rehab homes. So we did small rehab and code enforcement mitigation rehabilitations to homes. So if we think about HVAC systems, so AC systems, if we think about disability access, so if they needed a ramp, if there were other needs identified by families that were impacting that child's ability to get to school, to learn, to breathe, to thrive, those are the things we wanted to do and wanted to engage with them around, as well as having the larger conversation about the intersection of health, housing, and early childhood, which was important to us. So to date, obviously, Florida and COVID, that's all I have to say. That's all I have to say. Our whoever he is, leader. Yeah, so we were shut down for quite a minute, and then we were completely open, and we still are today. There's no anything going on. But yet our agency, we have not been in the office for 10 months. We took a scientific approach. We refused to go into any phases of reopening unless the positivity rate was less than 5%. And we're at 11. So we are not doing that, but that has made things very difficult. It has made, you know, construction jobs challenging. Families with children who have health issues are very hesitant about letting anyone in their home, obviously, to do any rehab. So I am still happy to say that we have been able to complete 3 rehab projects for families within the North End Rise area and have 1 more on the cusp. We had hoped to impact 10 at an average of about $2,500 per household, but with the increased costs of labor and everything COVID specific, we are realizing that cost is around $4,500 every rehab. So the max we'll be able to do is 4 projects, but the partnership that has led us to, and the mindset shift about not siloing these topics, I think overall is the largest win. Having people think about the interconnectedness of the social determinants of health, so education, health, community, employment. I hate COVID-19. However, I will say it has really brought to the forefront the interconnectedness and how partnering to impact people's livelihood and helping them thrive has been a huge win. And I couldn't thank my peers, NeighborWorks and CSSP for their efforts around this. Thank you, Kaylin.
Thank you, Jamie. And thanks for all the great work you've done there. So there we got to hear from a number of our partners, and now my colleague Selena Chavez is going to share our big picture lessons learned as we looked across all of these projects, some of which I'm sure will echo what you've heard from the community representatives already. And then we will have time for Q&A, so keep those questions coming in the chat box and the Q&A boxes, and we'll respond in writing or with our voices when we get to that point. So Selena, go ahead.
Yeah. Hi, everyone. I'm Selena, and I was on the CSSP end helping to run this action lab, and it was so great being connected with all the different communities and learning about what they were doing. And through all that, we had some key lessons learned, which many have already come forth. The first one, the name of the game for everything, it seems like, especially in 2020, was flexibility. So practicing flexibility with each other, with their partners, with the communities themselves and the families, and being able to shift where needed, already described with our presentations, but a lot of shifts had to happen because of COVID-19, finding ways to do things virtually, whether that be engaging families or even perhaps postponing a project until they had time to think about how they would shift. So no surprises there. The second lesson learned, meet families where they're at. Of course, project had to be cognizant of the needs and the wants of the families in their communities and what they were expressing, and think about how that would influence what the project was doing or even any shifts that had to occur. For example, one team was training families in the ASQ, and they realized that not every single family, every single parent wanted to be trained in this, but there were a group of families that were really interested in being trained in the ASQ, and so they focused on training those families. And meeting families where they're at was also physical, especially before COVID-19, but actually going out to the resource centers, family resource centers where families were physically at, to be able to meet with them and do outreach there. And then, of course, the last one, strong partnerships create strong communities. As we've heard, the partnerships between early childhood and community development really helped to build these connections and intersections across the families that are the same in the community, but showing up in different sectors. But not only that, there's importance to build connections with other sectors in the community. So while this was a start for building connections for community development and early childhood, a lot of the organizations that we worked with expressed the want and the need to extend those partnerships to other areas and other organizations and groups within their community. So moving on to the recommendations. Kaylin, can you move the next slide over?
It should be there now.
Oh, I'm not seeing it for some reason, but maybe it is my slow computer. There we go. So a lot of these we, again, already touched on, a lot of similarities between lessons learned and recommendations. The first one is to start off by just making those connections, reaching out to whether that be early childhood or housing and community development in your community, starting off with identity. Who are the community, who in your community provides housing services or community development services? Who in your community provides resources for families with young children? And just starting to reach out and make connections with each other. To educate each other about your work, we heard about how some of the communities in Alameda First Five actually educated and did training for the community development partners about early childhood development and early childhood education. So it was really helpful to get that expertise from each other and think about how your work affects families with young children in different, but also in similar ways. What can you learn from each other? Another recommendation, start small and then build up. Of course, it's great to have large scale projects, but our work found that first starting by building that trust and building with each other between early childhood education and community development. So was really helpful. So even if that was starting small with a small project and building trust with each other through that, and then being able to have that partnership over the years to develop and do better work with each other. And then follow parents' lead. Of course, we mentioned this before, but it's always important to think about what is it that the people in the community want themselves. What do the parents want? What do they want for their children? What do they need? And how, if you are involving parents within your work and within those projects, how are you compensating them for their participation? And then lastly, which we already mentioned, be flexible.
Great.
So
Thank
those
you,
are the
Selena.
recommendations. Of course.
Thank you. So we are open for some Q&A, and I see one question that's just been typed in. Well, first I'll address one that was typed in a long time ago, asking the folks from EdenHousing if they could share the pre and post survey they developed for Raising a Reader. So we are going to get a copy of that, and we will include it when we post the webinar recording and the slides. So you'll be able to access that there. And if there are other resources that partners want to share, just send those to me and I can get them posted on that site. We have a question that was typed in for Jamie in particular. So Jamie, do you have any papers or further resources around how you develop this community and properties? I think the references to bridges and to that neighborhood-based work. I love the idea of multi-collaborative, multi-discipline approach to social determinants of health.
Yeah, we actually have a 5-year report that might be almost 5 years old now, but it talks about how they identified the 10 communities based on child outcomes, all the work we did to engage residents prior to installing these bridges, and then all of our efforts around doing that. I'll also send Kaylin some information about the purpose-built community, because if you have one, you know it's based on like 4 pillars, which is education, housing, employment, and health. So those are, if you think about it, they align really, really well with social determinants of health. And another resource is to really just look up collective impact. So we really think about collective impact as, you know, you have this entity who's your quarterback, but then you have everybody owning their pie slice in the pie pan. We talk about that often with bridges, like, this is what I do. And then we had our VP of housing, and this is what she does. And, you know, one of the initial concerns was, do all the bridges or early childcare folks need to learn what it takes to rehab a building? No, that's not. You do your thing, and then we do our thing. And so it's that level of collective impact and synergy and alignment that really just clearly outlines each person's role in the relationship and what you're trying to get to.
Can you repeat those pillars of the purpose-built community?
Don't test me now. If I got it wrong, you can't call me on it. I think it's employment, or like economics, health, housing, and education.
Perfect. Thank you.
No problem.
We have another question typed in from Josh Stotts asking where the funding comes from for each organization. And I know that's probably a very different answer for each of you, but if some of you want to jump in with sort of how your entities are funded, please do.
I'll be happy to go first with EdenHousing. So our Raising a Reader program, we do a combination of charging our services to the individual properties that we serve, as well as subsidizing our services through corporate funds. And when I say corporate funds, in the affordable housing world, you know, we have, I mean, essentially they're profits. I don't know what the exact word is that we use, but, you know, money that we have as part of doing the work that we do, that we have more discretion over how we sort of direct that funding. And because services is such a key part of the work that we do, we put a lot of money into our services programming. So it's sort of subsidized at a corporate level. Additionally, we do get grants. We get grants from banks and other organizations. We seek out grants as well. But this particular project, we didn't have a specific grant supporting this. It was more just funds that we had available that we used.
Hi, I can go from EBALTC. So as similar to Jamie, we have launched, EBALTC launched 7 years ago, the backbone, like similarly like a neighborhood collaboration based on the collective impact model, the backbone or a community quarterback. And I will say City Foundation was our early supporter of this, and they provided support to launch our West Oakland collaborative, and then similarly our Healthy Havens Court East Oakland collaborative. And we can't thank them enough, because the idea behind it was large, like to run a collaborative, it really requires a big sum of money, right? And so it's not just small amounts, it's a significant amount. And they were very flexible with it. They said the idea here is to pilot, and it's okay to fail. And if you do fail, that's okay, but what are the lessons learned from that? And then also, what are the strategies that really worked, and build off of that. So in Healthy Havens Court, one of the areas that really took off in the collaborative, there's about 6 different other work groups moving, was the early education piece. And so City Foundation, I will say, was our original source of funding, and it allowed us to pilot several strategies, one of them being a parent university that was really successful. And then from that, we built off of that. And the Havens Court Cub House, now we got additional funding through the City of Oakland, essentially, to fund the Cub House, which is a 3-year initiative with the ability to reapply for the grant again in 3 years.
Thanks, Anita.
So ours is the most desirable, but the most challenging to accomplish. So our voters of Palm Beach County went to vote back in 1987, something like that. And they voted to take a certain percentage of everyone's taxes, like house taxes, property taxes, and assigned a millage rate to that. And I think, Laniqua, you might be similar in that way. And so in essence, our Children's Services Council is basically a children's fund. And so based on, I mean, we are Palm Beach County. We have, I just saw, just hot off the press, there are 71,000 millionaires in the county of Palm Beach. So thankful to them, we have pretty good funding. They have pretty good funding. I don't work for CSC, but they have pretty good funding, and they then take the needs of the community based on data, and then they dole out those funds appropriately to organizations. Like Anita said, very expensive to run a Bridges program. There are 10 sites, and we run 6 of them, and I only know our budget, and that's about $5 million a year. And that supports 5 staff at each of the bridges, plus program operations, et cetera, et cetera. And so if we use that, it's close to a $10 million investment every single year. And this is going on year 10. So it's a long-term strategy to really support families where they are. Hopefully they'll get over that bubble of disparity and then begin to work on community stuff. But again, they only do their pie slice, right? So then we need, as an organization, to bring in city, we need to bring in NeighborWorks, we need to bring in other funders, we need to fund develop ourselves so that we can bring on these other additional layers that our Bridges partners, who are great at engaging families 0 to 5, we can then bring some more of that other social determinant of health support around. So again, NeighborWorks, our cities, our CRAs, our banks, other folks help us bring other opportunities for support.
And then, thank you, Janie. And then in California, there is a First 5 in every single county, and we're all funded through a tobacco tax to really support our early care and education and child development. And in Alameda County, we use that funding to support families, communities, and childcare providers, really with a focus on addressing poverty, reducing racial disparities, and helping young children and their families grow up to be healthy and strong, and really focusing on their well-being. So leveraging all the resources that we have to really implement our early childhood system of care that works for families and works for communities.
Thank you so much. And I think everyone got a sense of the wide range of ways these types of organizations are funded. And I also think this highlights how much learning we have to do. I know I base myself more in the early childhood and family support side, and I didn't know anything about housing before starting to work with NeighborWorks, and I'm still learning more. And I'm sure this, like, as I think about how important that is for families, it's like, why don't I know this? Why aren't we more connected? And so I'm hoping that this this action lab and sharing this information kind of is a starting point for a lot of people to start exploring those relationships and learn who these folks are in your community if you're not already partnering, and how you might do that. So I really want to thank our presenters. I'm going to share a few updates from CSSP and from the Alliance on related work. So I'm thanking our presenters now. We'll stay on. If you have more questions, put them in the chat box or the Q&A. We can still respond in writing. But I do want to share a few more, just some updates about other work that's been going on at CSSP. Some of you were on our webinar in December, which focused on community conditions that strengthen families, and that is a piece of work we're really exploring more this year. So I encourage you to look at the report that came out about a survey we did, and watch that recorded webinar if you missed it, and stay tuned for more, because this type of work with housing partners is one piece of the puzzle of how we start to think more broadly about how communities affect the experiences that families have raising their children, and how we can improve those conditions outside of traditional early childhood services. So check that out, the report, and then you can find that recorded webinar on our website. CSSP also in December released a new policy platform, an anti-racist policy platform for early childhood called What We Owe Young Children. If you haven't checked it out, I really encourage you to do so. It's bold. There may be places you can hang your hat and say, this is the kind of thing we're working on and we want to be part of this. So feel free to use this in any way you can to build the case for some policy changes that could be really powerful in your community. And a lot of these are federal level policies, but there are parallels to them at the state and local level. And then I want to share, I just want to, just for a moment, Selena, I see you're putting links in the chat, but that is actually going just to the panelists, so you can change it to all participants, and then everyone will be able to see those links, just to make sure everyone can see those. I just wanted to highlight a few recent blog posts. Selena and I wrote a blog about this paper, so you can go there if you want to find the report or share it with others. We'll also be doing a podcast pretty soon about this topic, so stay tuned. That won't come out until a little while later this year, but we're excited about it. A few other recent blogs. I'm not going to go through them all. You can see them on your screen, but I encourage you to just keep an eye on our blog. There's a lot of content there that if you're interested in this topic today, you would probably be interested in those blog posts and our reports. All of our COVID-19 resources are in one place at our COVID clearinghouse, so I encourage you to look for that. And then I want to share a couple updates from the Children's Trust Fund Alliance. Our partners couldn't be on the call today. They're actually running the training. So I'm very excited that they're offering training of trainers for their curriculum called Bringing the Protective Factors Framework to Life in Your Work. That is normally offered as an in-person training. They've adapted it to virtual, and where they usually are going to a place to do it, and there's an organization that sponsors them, and they only have so many spots that are assigned with that organization. This is open to the public and it's virtual. So you can register and get that training if you're interested. It goes through the Strengthening Families Protective Factors in a lot of detail, really gets to understanding what those protective factors are and why they matter and how you can apply them in your work. So they're doing that February 22nd to 25th. You can already register for that one, and they'll be doing it again in May and for 2 other times this year. So 4 of those trainings coming up this year. And it is National Parent Leadership Month in February. So the Alliance will be doing a lot to honor parents as leaders. All of you who know the Children's Trust Fund Alliance know that they have a very strong area of work around parent leadership and a lot of strong parent leaders engaged with them. And so they'll be releasing videos and a social media campaign. Keep an eye out for that. And they provide a parent recognition certificate that's a fillable PDF form. So if there are parent leaders you want to recognize in your work, you can download that fillable PDF and use it to honor parents who have been leaders in your organization or your community. So check that out, and you can contact Martha Reeder with questions about any of that work of the Alliance. And as always, I want to thank you all for joining us. Many, many thanks to our wonderful crew of presenters and panelists for all the work you've done and for taking the time to share it with everyone else today. Thanks, everyone. Stay safe out there. Enjoy your weekend. And we will hopefully see each other in person one day soon. Take care.